Okay, TAC Talk episode, I think it's episode 7, but we'll go with that. All right, I'm joined by Tombo today, and I'm also joined by Jack from Flex Physio. Welcome, mate. Thank you for doing this. So I thought we'd just get started about, obviously, if you can, tell us a little bit about your background and also how you found your way working with Tom over at Flex Physio.
Cool. So I went to university in Ireland, Dublin. I graduated about 3 years ago now, so 2018. Went to Bournemouth then, so worked with the football club there from 2018.
Oh wow!
For that full season.
Did you study physiotherapy at uni?
Yeah. So did physiotherapy. Got the internship down at Bournemouth and worked there for basically the whole season.
Oh wow!
Worked with the first team.
Is that? I'm guessing that's whilst they were in the Premier League then, was it?
Yes.
Yeah. How was that working with Premier League?
It was cool. So when I was in uni, I didn't really know what I was going to do when I finished. I just kind of had a few things lined up, wasn't really sure, and then this came up with Bournemouth, and I was like, right, let's just see what happens here. And then next thing I was in physio room with Callum Wilson, Nathan Ake, stuff.
Wow, that's mental.
Did they approach you, or did you approach them? How does it
So
work?
a girl in the year ahead of us went. She inquired about it and went for it, and she did fairly well. So then they kind of right, let's put an invite out to that group, in that uni. So a few of us applied. I think there's 2 of us that got it in the end, which but it was surreal. It was.
Oh wow! Are you a football fan as well?
Yeah, so I support Newcastle.
Oh right, okay. Yeah. Oh wow!
No, it was good. We're kind of working the first team setup and seeing how everything's run at a Premier League level.
Yeah.
The year before they got their medical team got an award for basically the best medical team in the Premier League. So it was kind of going into that elite environment setup.
Oh wow.
Yeah.
How's the kind of obviously I suppose you're going to be speaking for Bournemouth, but how's the medical setup at a football club normally? Obviously, do they have doctors? How many physios do they have? How would that normally be?
Yeah, so normally Premier League clubs, the head of medicine is a doctor.
Okay.
So doctors there full time. Whenever they need to be seen, they get seen to basically. And then there's the head physio, who's some clubs. I say so I worked recently with a few different clubs, but at a lower league team. Yeah. The physio's the head of medicine.
Oh right, okay.
They can't really afford pay a doctor to be there full time.
Yeah, that makes sense.
So head of medicine, doctor, and then head of physio, and I think at Bournemouth they had. So as long with the head of physio who's a physio, they had 2 more physios, 2 sports therapists, and then they had a masseuse team as well, which was 3 masseuse.
Okay.
And then the sports science team was made up of 4 or 5 people as well.
Oh wow! So it's quite a big team.
Yeah, big team.
Oh wow! Man, so what was your kind of it's day-to-day job like? So say during pre-season, what would your kind of role be there?
So literally the first day we started was pre-season. So
oh wow!
Going in from being in uni next time.
Yeah, thrown in there. Huh?
Oh
yeah. right in the deep end. Yeah.
So it was cool because we had they're doing say what was it, the bleep test sort of thing where you're doing 6-yard shuffles and you're just handing bottles to Defoe and all these players.
Who was the manager?
Eddie
He was a long-term manager.
Yeah.
Wasn't
He seemed quite forward-thinking with stuff like that as well.
Yeah, he was good. He was on the ball.
Oh really?
Yeah. He's very approachable as well, which is strange for a manager to be approachable. But
really?
Yeah.
Oh, that's cool.
Pre-season straight in. Just helping out with the testing basically, because obviously we're only graduated. They're not going to trust you with right, this is your player.
Some important job. Yeah.
These guys are worth millions, so it's more a kind of helping out really. And then as the weeks and months went by, kind of trusting you more and letting you have a lead a rehab session with a certain player or whatever it is.
Yeah.
More with the younger lads starting off, and then more so then doing a bit more of the big names.
Yeah.
They never kind of let you have sole control of a player, which just makes sense.
Yeah. Did you find yourself kind of, especially during pre-season? I know you said you're helping out with all the testing and stuff, but is it essentially just making sure they don't get injured? Is that kind of, obviously pre-season you want to prep them for the season, get them fit, and but are you just spending a lot of time working on injury prevention and things like that?
Yeah, so the whole kind of premise of doing the testing was to make sure that you have numbers, so you can either basically if someone's low on a certain score or whatever, you can say, okay, this person needs to work on this to avoid this injury or whatever it is. Like kind of risk stratification sort of thing. And then you have numbers then, so if someone does get injured, you have numbers to refer back to. So this is what you were like pre-season, you're this score or whatever it is. Now you're injured, we need to get you back to that or above that level.
So like, do you like liaise with like the strength and conditioning coaches or like with these numbers, or is that how you guys kind of communicate?
Yeah, so at Bournemouth they had like a medical kind of side of things. So there was a medical testing zone, which was like the more intricate stuff, like ankle range of movement and stuff like that.
You don't test like isometric strength of muscles, like hamstrings and stuff like that.
It was all that sort of stuff, and then the sport science stuff was all like the big lifts, like 3RM, bench press, leg press, and stuff like that. So, and then, but yeah, obviously there's a good working group. It was very good there actually, because they had obviously two big groups, which sometimes in some clubs, what I've heard is that they like a power dynamic, so they want to be on top.
Want to be more important, basically. Oh, that's cool.
Bournemouth was really good. Like so the head of sport science is Dan Hodges, and then the guy that was underneath him, Ben Donachie, is now the head of performance at Chicago Fire.
Oh wow! MLS team. Wow.
And then the 23s sport science, Phil Keane, is now. It's with Cincinnati, I think it is. He's like head of performance Cincinnati, so he's gone out there as well. Like,
oh wow,
they have a good setup there. Really.
Yeah, oh that's amazing. So like, is there a visible shift between? Do you find as a physio, like during season, you're busier? Like, because I'm guessing it's more about just recovering from games and stuff like that. Did you find that was the case, or?
Yeah, so since I did my internship with Bournemouth, I went to Oxford United.
Oh right, okay.
And then I was with Bristol Rovers most recently in the first team environment.
Yeah.
And that was crazy because obviously with COVID and stuff, games got put back.
Oh yeah.
So we were playing Tuesday, Saturday for, I think the longest we went like 7 weeks. So it's 14 games in 7 weeks.
Oh my god.
Like, so
there was I mean it was early on, but it might have been about December time. But even in the Premier League, like the amount of injuries this season, I'm guessing it's because of the condensed fixtures was unreal. Like it's so high.
I've seen some of the stats around it as well. Obviously Premier League stats galore, but I think it was something like 70% increase in injuries basically from that time to the time the previous few years.
Yeah.
Something crazy like that. But the amount of players that were not there was a good few long-term injuries, but it was more sort of shorter-term injuries.
Yeah.
So fatigue-induced injuries where they build up a game for fixtures and they're not out for like a long period of time, but you miss 2-3 weeks, and in those 2-3 weeks you're missing about 6 games. So it's
is there a common with fatigue-induced injuries? Obviously, especially with footballers, is there a kind of a common exercise? Like, is it hamstrings or like kind of ankles or anything like that? Or
I think with the fatigue stuff, it's obviously the stronger you are and the capacity you have in terms of muscle strength and different terms of muscles, like the stronger and better you are in those kind of areas, the less likely you are to suffer these injuries. But it's more so the training load. So the acute chronic kind of what we use it a lot in the different clubs have been as the acute chronic ratio.
Okay.
So like Tim Gavitt does a lot of work around your stress and load in a certain week. So it basically compares your current week, which is the acute load. So how many kilometers you did against the perceived rate of exertion, and you multiply those scores to get like a acute load, and you compare that load in a week to what you've done the previous 3 or 4 weeks. And they're trying to keep it in like it's like I think it's 0.7 to 1.3 score, and if you drop below that, it means you're deloaded, more likely to get injured, and obviously if you drop above that, then you're more likely to get injured as well. So it's about keeping that load similar, but it's hard obviously when you have 2 games a week, because you might not play a Tuesday and play a Saturday. Next week you play Tuesday and Saturday, and that's 10-11k per game. So it's it's tough to manage with that amount of fixtures.
Do they so obviously if they base it on that acute loading, is that more down to obviously you've got the volume there, like kilometers, the games you're playing, what you're doing in training and stuff. Do they monitor? I suppose like results is too difficult to monitor, but because obviously the game's a game, like anything can happen in a game. Do they use things like heart rate or like kind of is it HRV and stuff like that to kind of monitor stress and things like that?
Yeah, so It's like when I was at Bournemouth, they did both, so they did the heart rate stuff and the train load stuff.
Okay.
And they had like complicated graphs of everything. Like there was one guy's job was basically to look at all the information you got from the training session and make it into a nice looking graph.
Oh wow.
Data.
Yeah. But I think in, like, say when I was with Oxford and with Bristol, they don't really use the heart rate stuff because
it's just more money, I suppose.
Yeah,
as well.
and it doesn't correlate as well as the acute chronic sort of stuff.
Yeah.
To injuries and prevention and that sort of thing.
Yeah.
So yeah, it's fun.
Like, do you see, like, having worked with Bournemouth and Rovers, with Bristol and Oxford, have you seen like a difference in like training methods and like how they affect players? I mean, like, for example, do you remember when Klopp came in?
Yeah.
For Liverpool, like there was a period where a lot of players were getting injured just when he came in. Do you remember? And
there was like different training intensity, wasn't it?
Different training intensity, and I guess players were having to adapt to that.
Yeah.
You know, like do you see like a difference in training methods at those kind of levels?
So when I was at Bristol, actually, I was there for 8 months, and there was 3 different managers. So.
Oh wow, you can see a big difference.
Yeah. Okay.
So that was very interesting in that, because obviously a manager gets sacked because they're not doing well, I suppose. So the next guy that comes in is like, right, he assumes that the manager before wasn't doing enough to get the guys winning games, basically. Yeah. So they come in and increase the loads.
Okay, so natural tendency is to do more, basically.
Because you want to get your information across as well. So we had massive spikes in injuries between the first and second manager coming in. Because you want to get your information across. So the more time you have on the pitch with a player or with a squad, you're getting your information the way you want to play football. Mm-hmm. So therefore they're out on the pitch longer, they're doing more kilometres, more meters of high speed running. Yeah. And then because of the games Tuesday, Saturday, you have less time to fit that time in.
Yeah.
And with COVID, we couldn't really do like analysis inside, which would normally kind of get your information across through look at this video, you're not doing this run properly or this properly. It was all on the pitch.
Oh, right, okay.
So injuries just went. Yeah. And it was during winter as well, so you're standing out around the cold for ages.
Yeah. I can imagine that's savage.
Yeah.
Did you find some managers were more like receptive than others to? So say if you Callum Wilson at Bournemouth, and you're like, Callum Wilson, he's got too much stress on his body at the minute. He shouldn't play. How was that received? Because obviously the goal of the manager is to win games, and I feel like, obviously from the outside looking in, I look at a manager like Klopp because I'm a Liverpool fan. I feel like he's quite, and I know he did sports science in uni. I feel like he's quite good at doing that. It'll be like, so and so didn't play because he just played too much or something. Did you find that there's a difference in all that?
Yeah, it's definitely different managers have different kind of views of like the medical sports science teams. So some of them, I've worked with like a good few managers, and some of them don't like the input from the medical team or the sports science team, so they kind of see it as like a negative.
Basically telling them what they don't want to hear. Yeah.
Which it is. Like if you're a physio, most time you give a negative news. You're telling the manager someone's injured or this person will be out for 2 weeks. Even if that's good news, it's still not great news because they're out for 2 weeks.
Yeah.
So some managers just kind of try and push that aside, and it takes a lot of convincing to get a manager on side. So it's where you have to use data. So you have to like.
I was going to say, if you show them data, they can't really dispute that, can they?
And it's literally making it as kind of user friendly as possible. So you're getting like dumbing it down basically. So that this is like, right, this is this. If he keeps doing this, he's going to get injured. Yeah. Instead of saying like all these fancy graphs and numbers, you're literally going, right, if you don't stop doing what we're doing, or if you don't give him a rest now, he's going to get injured, and he's going to be out for 3 or 4 games as opposed to missing 1 game.
Yeah.
Do they ever ignore your advice? Like,
sometimes I won't say ignore, but they choose not to take it on board. So they decide that maybe it's a really important game or whatever, right?
Well, that's what risk. Got a big game coming up. They might think, oh well, he might not start, but I might put him on the bench or something like that. I don't know. Like,
there's a few times where like you give your advice or whatever it is, the next thing they're on the bench for the game of the weekend. You're like, oh, all right, I didn't know that.
Okay, fair play.
Yeah, I always find it really interesting, especially like towards the end of a season, just because it's where most of the important stuff happens, right? Like qualification or playoffs or anything like that. Like, does it get quite stressful? Like, is it like for what you guys like? Because obviously as the season goes on, I'm guessing more, people start getting more injuries, they're getting tireder as time goes on. Like, do you find yourself just getting busier during that period and stuff?
Yeah, it depends on the squad size as well. Like you see Man City, they can literally switch their team around.
Yeah, and they're still amazing.
And they're still quality.
It's like £500 billion bench or something like that.
It's crazy. But like when I was at Bristol, we didn't have the resources. We had a few long-term injuries. We didn't have the resources to make a lot of changes. Really, you make 2 or 3, and after that, the quality of the squad is reduced, and obviously less chance of winning a game. So. Once you get a few injuries, and if they're big players, then you're kind of right, we need to get these big players back into the squad.
Yeah. How so say if like during season, a player's like, this guy he's starting to fatigue, his body's coming under too much stress. Do they then go on like kind of individual training programs? Because I'm guessing during season training's more about like movement patterns, like actual the gameplay and stuff like that, not so much about fitness, because your match fitness is developed throughout the season. But do you recommend like, so and so he's played too much, we recommend that he just kind of does this plan for the next 4 weeks or something like that? Does that happen? Or
so like there's some players that are just more likely to get injured, whatever with anatomical makeup and training history, everything, like the injury history, they're more likely to get injured. So you sometimes get players who if they go over a certain point they're going to get injured. So then it's a case of let's the manager's kind of on board a lot with that sort of stuff. And normally it's the star players that are like that. Yeah. So the manager wants them to play the games, and they basically say, what do we need to do to make him play the games? I don't care if he misses this session. Just let him make sure he's
recovered enough.
Yeah, make sure he can be in that Friday session, not taking part, but just be there to see the set pieces or whatever it is. Yeah, and then be available to play Saturday. Yeah. So you have a few players that are, I don't know how to say it, but they're kind of looked after and wrapped in kind of like
cotton wool sort
of thing to get them through to play the Saturday games. And you can see like Ledley King back in the day. He just played Saturday's games. That was it.
What a player he could have been if he was never injured as much as he was. So like, is the recovery often look like? Is it like massage therapy and stuff like that? Is there a lot of that, or is it more kind of strength work? Not so much strength, because I know obviously they're TACs, but like, do you focus more on the preemptive stuff than doing things like massage and things like that, or?
So different clubs have different philosophies, and it's run by like the strength and conditioning, sports science guys. Like, and you see a lot with the top clubs, they can do more strength and conditioning than the lower clubs because of the game fixture. So you play 38 games with Prem clubs, normally it's Saturday. Yeah. If you drop down the leagues, it's 46 games, there's an extra 8 games, so it's normally Tuesday, Saturday sort of games. Yeah, it's quite a lot. So at Bournemouth, they had like an upper and a lower gym session each week. And sometimes you had 2 lower sessions, one was based on strength, one was based on power, and then in upper body powers or strength as well. But then say at Oxford, they try and do that within the pre-activation stuff in the morning, try and do a bit of gym stuff, a bit of movement pattern stuff there, because they're generally just trying to recover between games because they're playing Tuesday, Saturday. Same way at Bristol as well. We try to get at least one lower body session in a week, which is normally a Thursday. So you play Tuesday, you're off Wednesday, train Thursday, do your gym Thursday, train on Friday and play again Saturday, and it's just kind of the whole process of repeating then. But there is a lot of the soft tissue stuff as well. Which again, evidence behind soft tissue isn't great. Some players like it.
Because I feel like it's one of those things where, like, I don't know, like a player, like it's a bit of an old school thing, like where like a player likes going on the massage bed and like getting a kind of sports massage, but it feels like a lot of the evidence these days is more towards like strengthening and stuff instead of just getting massages all the time. And obviously massages are, I mean, obviously you could go into more detail about this, but they're naturally just quite destructive in nature. So like, because you obviously breaking the muscle tissue up. So like during a season, like how effective is that? Like especially if they are playing, like is that just down to the kind of masseuse? Like, no.
There's a lot of players that they're on the bed every single day. Like before training, after training, you can name a few names. I won't. But
no. Because thousands of people listen to this podcast.
But there's a few guys that really be on their bed 24/7 sort of thing. And it's more sort of old school guys.
Yeah, I was going to say, can you see a shift between kind of the older players and the younger players with that?
Definitely, yeah. So the old school guys will be this is, can I get a rub my hamstrings, feeling a bit tight sort of thing. Whereas the younger academy kind of graduates are more in tune in that, because in academies you don't really do soft tissue stuff with them unless they're like Man United and stuff. I assume they do, but at like Bournemouth and Oxford and stuff, in the academy you don't do soft tissue because you're trying to promote kind of self-management in the players.
I'd imagine there's more compared to years ago. Like those academies, there's probably loads more S&C work going on at academy level. I imagine as soon as they become scholars, which is like 15, 16 years old or something like that, they're probably straight onto some like programs and like activation programs and stuff like that.
Like the S&C stuff is really good. Like they do. When I was at Oxford, the strength and conditioning guy there, Nathan Griffiths, he does go through podcasts actually as well. But he's really good at kind of doing the movement stuff. So under 8s, under 9s, when they kind of come in first, you do like the movement prep, so like the lunge, hip pattern and all that sort of stuff. And then kind of as they go through the phases, you're adding load onto that. And again, that's breaking down the myth of don't lift heavy when you're young sort of thing. If you're able to lift heavy and you can do so safely, obviously it's good to do so because you're going to get ahead of everybody else. But the S&C stuff is bred in from such a young age in these clubs.
Do you see like trying to think about how to word this question, like when it comes to injuries with players or performance, like in terms of like their build? I mean, like someone I can remember is Ronaldo. I'm a Man United fan, so just kind of watching how he developed physically, I think like he's like almost like a peak example of what you can athleticism, what you can achieve. But do you see like a difference in performance based on
physical attributes?
Physical attributes, like a player's build or their height or whatever. I don't know.
Yeah, so good question actually. So I think more the top level athletes, so the guys that play Premier League football, they're normally possibly genetically better gifted in terms of they can put muscle on better and they're more powerful and athletic.
Can you have too much muscle? Because I mean, like there's some players. I mean, like they're absolute units.
Akin Fenwa.
Yeah. You know, like are you more injury prone? I don't know. Like
So the more muscle you put on, the slower you're going to be as well, and like
agility and stuff like that. Yeah.
And we had like when I was in Bristol, there's a few guys who are very, very good footballers, and when they're injured, obviously there's a inclination to let's start getting in the gym more, and because you're not running as much, you're going to put on muscle more. And then they don't like it. They're like, well, I'm getting too big here. I'm going to have to put a kilo on in like 4 weeks, and they don't. So when we start doing rehabilitation with somebody, if it's like a long-term injury, say 2 months or more, we sit down with them and say, right, what would you like to get out of this? Do you want to put muscle on, or is it going to be detrimental to you playing? What do you want to kind of work on? And because you have so much time, you're not just focusing, say if someone pulls their hamstring, you're not just focusing on getting the hamstring better, you can use that time to work on other stuff, like obviously prevent it from happening again. We're looking at the hips and everything else, but if they're perhaps, like we had a guy who was centre half and was always a slight kind of character, he wasn't like the biggest guy in the world, and he was like, okay, I have 3 months around to play around with now, I want to get bigger so I can kind of push people off the ball, and got him on like an upper body program as well. So some players don't like being big, some players do like being slightly bigger, but again, you see in the Premier League they're normally more physical than they are lower down the leagues. Whether that's to do with obviously there's loads of different things to do with that, but most likely they have the better resources and education, and that's the way to kind of go with it. I
suppose naturally they're better players, so they've probably got better athleticism as well as that. So, did you find like positionally certain players struggle more? Because it almost felt, I don't know so much about it now, but like it felt like years ago, like strikers and certain types of strikers, especially if they were like brought into the first team really young, like Michael Owen always springs to mind, like just suffer with certain injuries like hamstring injuries or those quicker players. Do you find like positionally certain positions suffer more, or is it just too much of a broad statement kind of thing?
No, like there is research and data for so much these days, and positional variance and how much high speed running you do, how many accelerations you do, how many decelerations you do in a game. So you can look at a left winger versus centre half, and you can see straight away what differences would be there. You're obviously going to be doing more short, sharp stuff and
explosive stuff,
and centre half be more. They won't be running a lot.
No.
But because of the increased nature of doing that forceful stuff and higher speed stuff, you're more you're more likely to get certain injuries.
I suppose that would relate a little bit as well to that like acute stress as well, like because that explosive stuff, doing that over and over again is far more of a smash on your CNS than just kind of that slow, steady stuff.
Yeah, that's 100%. So you do see positional variance and injuries and stuff as well, which is why the wingers and quicker guys more than likely will get the hamstring injuries, because you're not going to get hamstring injury if you're slow.
Yeah.
You can, but you're not going to get more likely to get it if you're...
You'd be quite unlucky if you did in that
exactly.
position.
If you're forced to run, and then
That's not decent. So what made you come away from that then? How long did you work in football for?
3 years.
3 years.
Yeah.
Was that all as an intern?
No, so the first year was intern with Bournemouth, and then went to Oxford, worked with the 18s and 23s, and then the first team in a year and a half period moved kind of up through that kind of system.
Right, okay. Was there a big difference between working with the 18s and the first team at either clubs? Like, is it, I don't know, like less pressure or almost like more rewarding in a way? Like,
yeah. So like when you work with the academy, it's you want to get the players to the first team.
Yeah.
But you're aware like of the statistics, like it's 1% of 1% make it. So, like,
yeah, I can imagine. Yeah.
It's trying to give them the best possible chance of getting there.
Yeah.
And then when you're with the first team, it's about obviously results based. So it's not more so right, let's improve this player. It's about right, let's get this team to start winning games. Whether that's obviously injury prevention and all that sort of stuff as well. So I was with Oxford then, and then Bristol was in the first team last year as well. But
okay.
I think that to the first year with Bournemouth was like an intern year, and then after that it's been not intern.
Did you? So what made you come away? Was it just quite not enjoyable, or?
No, I loved it. It was just the work kind of life balance, and like you do Saturday games, and if it's an away game, you go stay overnight on a Friday, which is cool when you're kind of starting off. Like, get to go to away games.
Go away with the lads, and then
But then next thing your whole Friday's gone and your whole Saturday's gone because you're travelling back from the game. You get back at like 10 o'clock in the evening,
and then you're back in on Monday, kind of thing.
And you could even be in on Sunday as well. So if someone gets injured, you have to look after. You have to make sure they're ready for the next game. So you could be in on Sunday. So what turns out to be a short looking week, in that you're finished early and stuff, it turns into like a longer week. I enjoyed doing the kind of private clinic stuff as well, so I give that a go.
So did you come away from football and work for Tom at Flex? Did you straight away?
So Tom kind of contacted me when I was in Bristol, and there's a job opportunity, so I kind of gave that a bit of thought, and I was like, right, it sounds good, let's give this a go and see how it goes. And been here now 2 months and enjoying it so far. So
I was going to say, because it must be very interesting going from working with professional athletes, so like peak performance and absolute machines, to kind of just with general public. Like how's that been?
Yeah, so it is much different, but I think working in that elite environment gives you the skills and the tools to then work with anybody, sort of thing.
Okay.
You've done it, so you know what can get a player. So in football or in athletes, it's the 1%ers that make a big difference. So they're already strong in every single muscle in their body, otherwise they won't be where they are. So it's a little improvements, whereas if you get some general population, generally there's obvious flaws or obvious issues at play. So it's easier to kind of make a difference. Just change, get them to do a few little different things, and it makes a massive difference, as opposed to a footballer or somebody. It's like you have to be really, really specific in what you do. But it's only a certain little thing that's different that you can change, sort of.
I suppose as well, like that really small change, it doesn't necessarily give a huge difference. It'll just give a small difference, but small differences matter so much. And I suppose in a team game as well, like you kind of see that less. So what's kind of like, obviously you've kind of come in this post-COVID, what's the kind of common, I don't know, injuries or issues you've been dealing with so far?
A lot of it is like tendinopathies and overused injuries. Obviously everybody's been doing a lot during lockdown, or either have been doing a lot and then come back and do a lot now since. But gym's been open a month or two now?
12th of April, 5 weeks.
5 weeks?
5 weeks today.
So that's generally the period where they try and self-manage themselves. So they get back in the gym or get back running, start being sore or wherever it is, try and manage it themselves, and then now they're realising, this isn't going away, I need to get help from a physio or whatever it is. So you've seen a lot of that kind of sort of stuff now, whether it's tendinopathies or just patellofemoral pain syndrome for knee pain or whatever it is really. A lot of overuse stuff, and then obviously you get your chronic low backs and stuff like that as well. But a lot of it is kind of COVID driven as well.
I can imagine, yeah. So I was going to ask, so with our gym, with the athlete centre, like we have more of a, I said to you briefly before we went on air, that it's something people take very seriously, even though they do it recreationally. So people really focus on that sports performance side of things. You know, they want to improve their weightlifting skills, so like the traditional like Olympic lifts, and then the gymnastic skills and the kind of conditioning stuff. But I suppose, and I suppose as a fault of the fitness industry in general, is not much is done in terms of injury prevention. It's just all about like getting stronger, getting fitter, and all that kind of stuff. And I think you could say that about the gym anyway. Like in terms of bodybuilding, it's all about, you know, doing more of the stuff. Like what do you think is kind of a common thing lacking in your average people going to the gym? Like, you know, is it, you know, because what's quite big at the minute is like glute strength or, you know, hamstring strength or whatever. Do you think there's a common thing that you can kind of put a blanket approach onto it, or?
Good question. So generally, as you mentioned, glute strength or a certain muscular area, you can get like, take 10 people from the gym and we can assess them here and now, like, and you'd find something that's sticking out. Yeah. More than likely it's some sort of glute orientated strengths. Because obviously everybody's sitting down nowadays, they're not using their glutes as much as they should be. Especially with COVID, working from home, you're not even going commuting, you're not walking into London, or you're not walking to get a train. Even those simple things, you're using your glutes more. So glute strength I suppose is a big one. Do you think that's the same with like athletic performance as well, like glute strength being like a limiting factor there? Do you think that's even just for an average person who wants to perform from an athletic point of view, like is the glutes a limiting factor, or the most is the lack of glute strength the most likely cause of injury, do you think? I say it's more like control and mobility of their joints or stuff. Like the glutes are like the powerhouse, so if you have good glute strength, you can jump,
produce
run,
more force,
you can do all that sort of stuff. So if you're lacking in that, you produce less, and then that's more likely to get injured. But you can say that for any muscle. You can say that for your soleus, your gastroc, hamstrings. If you're weaker in those muscles, you're more likely for those muscles to get injured. So a risk factor for any muscle injury is weakness in that muscle. And it's the control and mobility stuff which is getting kind of quite big now in the last 4 or 5 years. You used to hear a lot about mobility and
stability and things like that.
All that sort of stuff, which a common person lacks because they're sitting down all day. So they're not moving into ranges that they need, basically. You know?
They're like train a range that they've not developed strength in, essentially. So like, you know, they'll get into a deep squat, but they've never been in a deep squat position, even sitting down in that position. Load it, and then you start seeing injury problems as a result of that. I'd imagine.
Would you say there's like, how do I call it, a lack of like prehab or prehabilitation with people going into training? Like their bodies aren't, well, as Zak just pointed out, they're not ready for the extremities that they kind of put it through.
I think a lot of people don't understand. They just go into the gym and they just do whatever it is. Like they've seen some on YouTube, or they start smashing the gym, start doing the machines and that, but there's not a lot of focus on the smaller details about, like, ideally you want to get someone 10 minutes, 15 minutes before they do a session and do a bit of work-ons or whatever they're lacking, whether it's hip mobility or hamstring strength or whatever it is, and do a little bit of that before they then go into the gym. You go in, you know, with anything, if you go in cold to something, you're more likely to get injured again.
I mean, well, prime example was like, I mean, years ago I had a goal of wanting to be able to like do like a handstand, but like I didn't know anything about like what I do now, but I just spend loads of time just like getting on my hands. Over time I started getting wrist pain and developing you ever develop like is it called like a ganglion cyst?
Yes.
Like, and I mean, what I know now was that I was just going into it with unconditioned wrists. So like, you know, now I know that I do a lot more wrist conditioning before I go into training or going upside down at all. Doing warm up your wrists instead of just going in and doing all that kind of stuff. And I think a lot of people do the same thing in other areas. If that makes sense.
Yeah, like running's a massive one. So people.
I think it's because people can run. That's the problem.
Yeah.
It's like it's a good thing, but it's also a problem. And I think people just go out for a run. Like they haven't done any activity in 3 or 4 months, and it's like I can run. I'll go out for a run, then
if there's some, as you said, if there's something, whether it's wrist range of movement or like say for yourself, or if you're running, if there's an ankle limitation there or hips instability, whatever it is, if there's something little, if you repetitively do that, it's going to lead to an injury.
Yeah.
I
think as well, like I feel like over probably the past 10 years, and I think with CrossFit as well, there's been so much focus on like big compound lifts and functional movements, which is great, but the muscle isolation exercises have kind of not died out, but people do them less. But there is a place for that stuff, like even doing things like, I suppose, like calf raises to strengthen your calves and your soleus, and even like bicep curls. Like if you want to be doing like loads of pull-ups and you've got no bicep strength, I suppose that's quite problematic as well. Is that everyone wants to just go into these big compound lifts because they're more beneficial from a strength and fitness point of view, but if you haven't got like good hamstring strength or even quad strength, like sticking 100 kilos on your back and back squatting it, like it could potentially be problematic.
Hamstring curl machine, man, it's underrated.
That's underrated. Like if you're doing your big compound lifts, or you're going to get better at them because you're doing them.
Yeah, you're like training the movement and improving the movement.
But there becomes a point where then you don't improve, and it's because there's probably a limitation somewhere in the kinetic chain that if you kind of try to clean that up, you could start lifting more. So there's always the add-ons that can make a big difference. It's all those smaller little isolation mobility work that makes a difference to your overall kind of performance, whether it's compound lifts or running, whatever it is.
Do you think people can be guilty of, we touched on mobility, and I think like mobility and stability like tie in quite nicely. Do you think people are sometimes guilty of like trying to be not over mobile, but they just focus on mobility and not necessarily train the range, for example? So like I know like we tend to do quite a lot of overhead squats and like I find that one of the things people struggle with is not necessarily the position, but it's holding weight in that position. So like they start going down, their arms start bending and stuff, but if they did it with no weight, they can keep it there. Do you think sometimes people can get too caught up in just stretching and stuff like that?
Yeah, so like mobility is basically flexibility and then control of that flexibility. So you see people that just stretch, and you're getting flexible, which doesn't last. So you stretch a muscle, and if you don't do it for a week later you're back to your normal resting length. But you need to be able to control that length. So like if you, for example, if you train your hamstring to be able to hold a certain range, not really explain this well, let me see. So your range, your muscle, your brain basically wants to limit the movements that you don't do. So if you don't, say if your bicep, you don't actually use this range, you're never in that range in normal life, you keep your hands like this, it doesn't happen. But say if you only ever use this range, your brain then makes it weaker to use this because you don't use it basically.
Okay, so it like neglects it naturally. Like,
so if you then start stretching and I can use this, but then you don't use it in your normal everyday life, it's going to come back up to here again. So your brain's like, he's used it for like a day, let's keep that range for a day, but then it's going to go again. Same for hamstring. If you stretch, that's fine, you have that range, but you don't have control, you don't actually own that range really. So you need to start doing like active contractions in that range to teach your brain that you actually want to keep that range, if that makes sense.
That makes sense.
Sorry, no, carry on. I was going to say something about
that. I was going to say, like, because obviously, like, glute activation's become quite a big thing. And would you say, because I see a lot of people do like banded kind of glute work and stuff like that for the kind of activation element. Do you think sometimes people kind of maybe should focus more? Because I don't know whether this is true, but do you feel like you still have to load your glutes, right? So like, you can't just do banded work almost. Like you have to do some lunges or split squats or something like that to kind of actually get some, because it won't necessarily transfer well to an exercise where you're loading it if you never load it. Like, would you say that's true? Like,
so it obviously depends on what they want to do. If you're trying to get improved performance, you obviously want to put weight through something. So the higher the load, the more strength that a muscle gets basically. and you're not getting much lower with banded stuff. That's activation basically.
Yeah.
Which
so how do you know how that activation works? Is that just essentially like just muscle awareness? Like
so it's hard to explain. You basically want to, like, if you've got some people, like a normal hip thrust.
Yeah.
If you've got people to do that, sometimes for whatever reason, somebody can't maybe activate one glute. You can squeeze one, but they don't feel the other one squeezing.
Yeah.
So there's like an inhibition there, whether that's through a movement pattern thing or whatever it is. So if there's like an inhibition or a deficit somewhere, like say glutes for example, if you can't, so when you're squatting you always feel like, oh, this one doesn't squeeze as well as the other one's not firing. So by doing a bit of pre-activation stuff, by doing, like, even sometimes they might not even feel it when they're doing the banded clams or the banded crab walks. So it has to be more isolated and specific. So if you get that muscle contracting, then it's more likely to contract in when you do the actual lift, because your mind muscle connection is switched on, if that makes sense.
Yeah, that makes sense. You want to say something?
He's leaning in.
I was thinking, like, going back to like stretching. Like, are there any kind of stretching techniques that you'd recommend? I mean, I'm trying to.
Because you have like static stretching, PNF and
PNF.
Yeah.
Is it reciprocal inhibition? Like, is that what it's called?
So
I'm just trying to think back to my PT training days. I'm like,
so the stuff the mobility stuff that is called F4C, like functional range control, I think that's what it's called. Where you basically try and get control of a certain movement. Who's the guy that does a lot of it? He's like Ian Marlowe. So there's loads of stuff on Instagram, but where you hold a certain position at the end range, and then you're doing like your contractions, whether it's the reciprocal stuff, so you're contracting the tissues on the other side of the muscle, or the actual tissue that's in that range. But it's basically just trying to get your brain thinking, okay, I can actually contract in that range.
And like on demand almost kind of thing.
And then you're doing controlled. So say, like, for example, hip flexors, you could be in like the split squat or split lunge position, and then kind of bringing that top leg up, because that's like an end range sort of stuff. Like just kind of
I see what you mean.
Doing lift offs and then like relaxing, contract sort of stuff. I think that's like the PNF stuff's really good for increasing range, like quickly. You can get like 10-20 degrees.
You can do quite a lot even in a single session, can't you?
So I think that's really good. So if you can, for PNF, you can then go and do your gym session. So you do PNF stretching, you have more range for that session, but then you're not going to really have that range long term.
No, so you'd have to do that, because you'd have to do that regularly, I'd imagine, for it to be truly beneficial. Because I do PNF stretching with some of my clients, and the increase in a single session is incredible. Sometimes you're like, wow, that's amazing, but like, I suppose you'd have to do that a lot for it to be truly beneficial instead of just being beneficial for that session. Or
like it's really good for doing like PNF stretching and then go straight into a workout, and then you have more range, you can do more in the actual session. And then it gives you, I suppose, if you have that extra range and then you're doing a gym session into those ranges, you are getting stronger in those ranges, so you are using those ranges.
So you're essentially increasing your range of movement by doing that first and then doing the session. With correct, if you do the session with the correct range.
Are there any kind of, like, as being a physio, obviously, I'm sure that, like, similar to us being PTs, you're always constantly learning. Are there any kind of like top end physios that you follow, like whether it be on social media, Twitter, or anything like that? Like anyone you kind of look out for, anyone you recommend?
The more you know, the less you know, really, isn't it? Like I'm doing a master at the moment, in sports and exercise medicine, and each week is like a different topic. So this week we're doing like lower limb tendinopathies or whatever it is, but you start like, you have to basically read loads and loads of papers throughout that week on different topics, areas, and you start reading something, you're like, oh, not heard of that before. This is like something that was published last year and you're taught in uni about a few years ago or whatever, so you haven't come across it. And you delve into that, and then you realise, oh, there's so much stuff I actually don't understand, and in the physio world, in the fitness world. Is
the literature, like, is it always changing?
I was going to say, I can imagine it's constantly developing, because things, even like we were just chatting about how like the sports massage is not dying out, but people are doing it less. But that seems very quickly, because even like 10 years ago, sports massage seemed like the thing to do and the way to go.
Like the research is basically saying now strength. So the stronger you are, and again that mobility control stuff, but the stronger you are, basically the less likely you are to sustain injuries, the more likely you are to be able to do your normal everyday life sort of stuff, which is there's a lot of physios and practices that don't believe in that as much, or they haven't kind of come across it. So whatever reason, they haven't probably looked at the literature or whatever. And
I suppose I feel like you should always use, I don't know, but like athletes are always obviously the top of the spectrum, but they also demonstrate the best physical attributes of a human, like whether that's power, explosiveness, mobility, depending on the sport they do. So I kind of feel like sometimes you should aspire to, not because you're not going to necessarily always be like that, but like if they're doing it a certain way, why don't you think it would work for you, kind of thing? And like, if I feel like where you were saying about like the strength, that's come from the athlete side of things, and like, whereas I feel like not a lot of physios, but some physios might not be in that athlete world. They're just in their own world. We're dealing with like general public. That might be where they're not seeing that because they're focused just on treatment and stuff, I suppose, which is where the massage comes in.
I'd say a lot of the issues with the physio world now is it's all kind of treatment and manual therapy, which is really good. It's needed sometimes if it's used in the right way. But if you make someone stronger and affect it that way, it makes a much bigger difference. Yeah, which is one of the reasons I kind of said I'll help, or I'll work for Tom, because he kind of believes in the whole area as well, and the whole clinic kind of centres around the strength kind of side of things and the rehab side of things. It's not just giving someone a bit of treatment and that's you give them exercises to do to make them better, and it's that whole rehab process of, as you're basically training them in that athlete way, obviously not as much as you were a professional athlete, but you're trying to give them that little bit of, this is like what an athlete does, is what we should be doing sort of thing as well.
I think that's kind of how we approach CrossFit, and I think that's why CrossFit's been relatively successful, because like in CrossFit gyms you call members athletes, like they call them your athletes, and I think it's quite a weird thing, but it's also quite an important thing, because like ultimately you're trying to train like an athlete. You might not be able to do as much as them or whatever, but you're doing the same movements, you're doing and all this. And how do you think that's received from your end, like trying to do that? Because I feel like as a physio, like people always go to you because they're like, I want a massage, or, you know what I mean, I want to be fixed there and then. Is it quite are people a bit like disappointed when you turn around and say, well, no, you need to do these exercises and stuff like that?
I suppose there's a bit of both really, but there is obviously a misconception, I suppose, that people think that they're gonna come to you and you're gonna fix them straight away. It'd be nice if we could. But it is that rehab process, and obviously some people won't buy into that as much as others will, but it's a case of educating them and letting them know, right, this is what the research basically shows, and if we make you stronger in this certain area and do this and do this and do this and set you off and do that yourself, you'll get better. And if they see that, they're getting small results, because normally if somebody it's different. So if you're an athlete, it's harder to make that jump. So it's hard to make strong stronger. It's easier to make someone weak strong. Yeah, definitely. So like beginner gains, basically. Exactly. So you can see most people that come into a physio practice or whatever it is, they're not doing a lot of gym and S&C stuff. So if you start introducing that to them, they'll see a big improvement, whether it's in pain or function, straight away. So from that, then you get the buy-in from the patient that, okay, this guy knows what he's talking about. This maybe is the right way to go about things, and it's that education and I suppose beginner gains as well that help with that sort of thing.
Do you ever just try and keep things simple with your patients or clients? I haven't really been seeing many physios in my time, but like even being PTs, sometimes we can be guilty of like overcomplicating things, using all these technical terms when we can just put it in like layman's terms and just say, look, like your knee's grumpy, rather than saying, oh well, I don't know, but you could use just some ridiculous term that a client doesn't really need to, no one needs to know. You just need to say to them, look, this is the issue.
I think we're all guilty of that, aren't we?
Definitely. I definitely think that's people. Well, I don't know. Like I think the industry's changed a little bit, but I think there's a period in the PT industry where like people trying to do backflips on stability balls and stuff like that. Always trying to do something special. But now that's shifted a little bit.
I think with patients more, it's about like simple terminology that they can understand, and that helps buy in. Like say with footballers and stuff, it's a bit different, because they're like, there's a lot of guys in the football world, footballers themselves, that have been injured so much that they kind of adopt a medical way of speaking sometimes. So when they're speaking to you, they're like, okay, they have like anterior knee pain, or it's posterior, or it's like medial to that, or distal to that. They kind of use these words that you're like, oh, how does this guy know what those words are? And they ask for those explanations much more so than a normal patient would.
I suppose they want to understand it more from a performance point of view as well,
exactly.
Especially they've been broken so much. Like
it's their life, it's how they make their money as well, so they need to understand it and they want to understand it.
Yeah.
Obviously, they're all different anyways, they're all different people, but a lot of them kind of want to understand what's going on, and it's a lot more educating them in depth than how you would like a normal patient as such.
How's your train? Like, what do you train like in the gym?
So I play Gaelic football.
Oh, do you?
Yeah,
okay. Mate, that looks carnage. That's kind of like. Is it kind of like rugby?
Yeah. So the way I explain it is like a mix between rugby and soccer.
Okay.
But yeah, no, it's pretty cool. There's a team out in Horsepass. So.
Oh, is there?
Oh wow.
Yeah. Oh, mate, that's decent. Cool. So what are the rules of that then?
15 aside.
Okay.
No.
Bloody hell, 15 aside.
That's big.
The same as a rugby team, I suppose. Yeah.
And it's not like you don't have to pass it backwards. You just like mark up. So it's like 6 defenders, 2 midfielders, 6 attackers, and a keeper.
Okay.
That's the basic setup of it.
Yeah.
You can hold in your hands 4 steps, and then you have to either bounce it or solo, which is like a kick into your hand.
Okay. Yeah.
And then you keep repeating that process. So 4 steps. We can't.
So you can't like just run straight with it. It's a bit like basketball. You can't travel basically. Yeah.
You can run the whole pitch, but you do it in like 4 steps, bounce, 4 steps, solo, 4 steps, bounce.
Yeah. Is it a round ball like a football?
Yeah. It's like a leather ball. So it's a bit harder than a normal football, soccer ball. And you can kick it. You can punch it to pass to somebody. Like say they're close, you don't kick it at you. Like so, just
tap it to
you.
Yeah.
If you get in underneath the goals, like a normal goals, it's 3 points, and if you get it over like the upright, it's a point.
Can you throw it over?
You can punch it over,
Yeah. Can you kick it in the goal?
You
as
can,
well?
yeah.
Oh wow! What's the goal? Is there like certain positions? Like, can the goalkeeper like only use his hands and stuff like that, or?
Nah, it's just free for all.
Free for all.
So it's handy. Like the keeper gets the ball and runs out with it.
Yeah.
You can kind of cover for him because you're doing the same sort of job.
Oh right, okay. So it's not like in football where the goalkeeper's the only person who can use his hands.
Nah.
Wow. How long have you been doing that for? Quite a while then, have you? Like,
so in Ireland it's massive. Like it's like a cult sort of thing.
Oh, is it? Is it a bit like Aussie rules in?
Yeah, it's very like that.
Is it? Yeah.
It's quite like Aussie rules actually. Yeah.
Is it?
But in Ireland, like each parish, so like even a parish, if you only have like 300, 400 people living in a certain little village, they'd have their own football team, like, and they compete against the other towns.
Oh right. Is it quite tribal?
Oh, massive.
Is it?
So I used to play when I was younger, and then went into I started doing I was into like athletics and did triathlon and stuff.
Okay.
And I kept getting injured, and then came over here, and then I didn't really have time to do all that because you need to train. Like I was training in uni, I was training like 20 hours a week for triathlon and stuff. So
oh right, okay.
There's no time to do that working as well.
Yeah.
So then I joined the football team and
it's keeping you fit.
Yeah.
What distance triathlons were you doing?
Just the sprints.
Sprint ones.
The shorter distance ones. Yeah.
Oh, decent. So how's you do you do much gym work for your Gaelic football, or do you just train and play kind of thing?
Well, I do a good bit of gym, to be fair. Like when I was at Bristol, obviously once everything shut down with lockdown, there's no football. So
that's true.
But we still did the gym at the club, so I could still gym.
Oh,
so
that's
I just
quite
got
good.
into that more so than being able to do football.
Yeah. Oh, decent, man. Mate, well, I think we'll call it there because I reckon we could do another one another day. But mate, thank you for doing this.
Thank you for having me.
All right,
that's cool, man.
Sweet.